Welcome to a Saturday edition of the Fireside Chat. We weren't sure what attendance would look like today. I think there might be some more people trickling in as we get going. But thank you so much for taking some time from your busy weekends and a Saturday to join us. We have some pretty exciting announcements, and we will archive this as well. I'm just going to actually turn people's video. We're going to do no video. We're going to record this, and so we're going to do videos off for the duration, which is what we typically do. We'll record this for folks that aren't able to attend or folks that want to go back and watch it later and send that out in another newsletter. There should be a chat available too. So if you have questions or things that come up, you should be able to chat the hosts during the talk. So please feel free to use that as a way to communicate. Other than that, we'll get right to it. We have a little bit of a packed agenda, and we want to get through everything in the course of the next 30 or 40 minutes so we don't tie up too much of everybody's time. The things we'll be covering are on the slide that hopefully everybody can see right now, which is this whole notion of kind of wave hiring and onboarding. We want to get into that as sort of it's a twist in terms of what people are used to from a normal hiring experience. I think everything we're doing is different than a normal hiring experience, to be honest with you, but that's certainly something we want to dive a little bit deeper into and explain so that folks understand what the expectations are and get excited about that. The second thing is that we have a very big soft launch coming up. And so we're going to provide an update as to when that is and really what that means. The third thing on the list is disclosing the big potential partnership for 2025. Very excited about this and want to get some real energy around it and hear your thoughts as well. We had a number of really good suggestions of things that people thought the partner, they thought the partner might be, and we'll talk about that too in just a bit. And then we just wanted to mention a little bit about the remote nursing conference and our support of it, and how exciting that's going to be for all of us to learn and network and see what else is even out there. It's definitely not a ShadowNurse. It's not all about a ShadowNurse kind of conference. It's going to be something where everybody can learn a lot from other experts in remote nursing and about other job opportunities and things that you can augment your income with and ways in which you can build your skills for remote nursing. So those are the four topics, and anything else that might come up. Again, please feel free to use the chat if there are questions as we get going, and we'll monitor the lobby as people show up and trickle in. So first things, Olivia, were there any opening thoughts from your side? I think that was kind of our opening gambit. Awesome, thumbs up. So what wave hiring? What is this concept of wave hiring, and how are we utilizing that here at ShadowNurse? So it gets really to the heart of what we're trying to offer as ShadowNurse, as a company, as a platform, as a service to customers who are patients. We also view you, the nurses, as a customer of sorts because there's an ecosystem we're trying to create, which has, on the one hand, patients that will need services, and on the other hand, nurses who want to provide services in the capacity that we will do such as ShadowNurse. And so for now, we are looking for a group of nurses that will support us in the very early stages of launching. So this ties into topic number 2, which is the soft launch. We are dipping our toe in the water, if you will, to make sure that all of the kinks are worked out and that there's no bugs, as we like to call them, or issues related to the service or the way the service is being provided or the technology that's supporting the service. And so because of all those complexities that go into that, we are starting with a very small group of nurses, on the order of like a handful. And so we understand there's a lot of folks, including yourselves, potentially chomping at the bit to kind of get involved, and we really appreciate that, and you are top of mind. But for now, we've gone through a really extensive process to whittle it down to just an actual literal handful of people who will be kind of taking it on the chin for everybody, if you will, to test the process. And for a variety of reasons, they have the characteristics and attributes that suit them well to do that. And not everybody has those attributes, and that's okay, because the attributes that you have are things that we will need soon enough, very soon, probably, if you weren't selected for this first wave. So nothing to be ashamed of or afraid of or anything about that with the first wave. The second and third waves will probably, it's entirely impossible to predict because it depends a lot on a number of things: marketing, the patient volume that we have, success with things like this partnership. But waves 2 and 3 could happen fairly quickly. I'm imagining that over the course of the next few months, we will be bringing on 1 or 2 more waves of nurses, and every wave will get bigger and bigger in terms of its volume of folks being onboarded. I think we've been pretty clear in our messaging that we are trying to create a platform that has a place for everybody that's qualified. Any qualified person that wants to be a shadow nurse will have a place as a shadow nurse eventually in this ecosystem. But as premium members, we've made the promise to you that we will always be evaluating your candidacy first. You've kind of raised your hand to say, hey, I'm like really eager and interested in what you're doing and very supportive of it. And in return for that, we are obligated and want to showcase you as soon as we possibly can. So just know that we are keeping that close to the heart there in terms of how we evaluate folks. Onboarding. So once you've been selected as a candidate for a wave of coming on board, we will put you through an onboarding process so that you'll feel very comfortable when you finally get, when we finally, I don't really know, announce you as a shadow nurse, and you sort of join the effort. And so the onboarding process is one that will probably involve things like training materials that we will distribute to you, in addition to some eventually onboarding videos and things that make it really easy and fun for you to sort of watch and pick up on how we do as shadow nurse and how we carry ourselves and the services that we offer and how we make that all work. So you'll have plenty of opportunity, and then live sessions as well with us and other shadow nurses who eventually will become more like managers of nurses coming on board. So there's a whole ecosystem, as I said, that we're putting together in that respect. And so that's really the essence of wave hiring, and it's kind of a rolling matriculation, if you will. That's another way to think about it. So we do, in addition to premium folks who are really declaring themselves as interested and eager, we are looking at longevity. And so the people that have been sort of like with us the longest are also folks that we want to try to get into the system as soon as possible. Olivia, any other thoughts on wave hiring and onboarding? We're really, just one last thought while you think. We are minutes away, literally, or moments, if you will, away from going through the onboarding process with wave 1. And that's all, we're trying to time that in sync with the soft launch. So these wave 1 nurses will be the handful that are taking on the soft launch and really kind of dealing with the complexities of that. Olivia, any other thoughts? Nope. Okay. Awesome. So I don't see anything in the chat. Feel free to ask any questions there if you want, and I will move on to the soft launch. So the soft launch is basically our coming out party, if you will. This is a chance where we can do that in a way where we're kind of not going completely, we're not disclosing everything completely. We're going at sort of a select market with a small group to do some test. It's more than beta testing. Beta testing is really what happens upstream of a launch of this nature. Beta testing is sort of like proof pointing and like really making sure that there's a there and that there's people that are interested in doing this and that we can actually connect the wires to make things happen. So we're well beyond beta testing, but we're not ready to just throw it out to the world completely at this point. Because why? Because things will break and there will be problems and there will be bugs, as I mentioned, and there will be kinks in the wire, and the handful of nurses that we're using for wave 1, there will be problems. They will have issues. There'll be communication problems. There'll be technology problems. There'll be patients that have expectations that aren't aligning with ours. There will be problems with our team and the folks that are building ShadowNurse. And these are things that Olivia and I have come to recognize as having been in health technology for the last decade or more. And it's better to go in with your eyes open and anticipating these things, and hoping for the best but expecting the worst, before you fall on your face by releasing to the entire country and having an influx of patients that are all having this problem now multiplied by thousands. So the soft launch allows us to have it's like a practice launch, if you will. And we'll have a big grand. Well, there's two ways to approach it, actually. Before I promise that, we would either then, after we have a successful soft launch period, and that a soft launch period might last anywhere from 6 weeks to 3 months, something along those lines. And then we could either then decide, hey, this is perfect and everything's working perfectly, and we could open it up. I'm going to just admit somebody here while we're talking. We could open it up at that point to everybody, or we could do rolling launches, and we could roll it out in a way where it's like, okay, we've launched to this small market for our soft launch, and now we're going to roll out to a slightly expanded market, and then a slightly more expanded market, and a slightly more at intervals, right? So maybe every 3 months we're launching to a slightly larger market, and you could conceive of a market as being like an area. It could be a geographic location. It could be a target demographic, in terms of the type of customer and their attributes, things along the lines of they are members of this certain organization or group, or they're of a certain age demographic, or their families, or they're individuals who live alone. So these are all different markets that you could conceive of rolling out to. Or it could be geographic, as I said. It could be like, well, we're going to start in New York, and then we're going to go to Florida and California and Texas, Michigan and such. So there's a variety of different ways to roll out after our initial soft launch, but the soft launch helps us figure those things out. And so the key date that we are circling around, and I'm going to get this wrong, even though I should have it completely and indelibly memorized, is November 22nd. I want to say. Olivia's probably going to say it's the 23rd. Anyway, it's that time frame, and so we have a very short period of time between now and then to really race to get to that finish line. But on that day, we will be, and I'm going to admit some more people here, and I'm just going to pause for 1 second. So folks that are just joining, welcome. The first 10 minutes we're dedicated to talking about the wave hiring process and sort of what that means. And now we're talking about the soft launch. This is all being recorded, so we will archive it. So I encourage you to go back and sort of watch that first part of our discussion. Along with the soft launch, here are the things that we're going to launch. Basically, we are unveiling a brand new website. The website is completely rebranded in almost every single way. And it will include two major components. The first major component is a new section for the nurses. So all of you, if you're interested in visiting the website and seeing things related that pertain to shadow nursing and onboarding and becoming a shadow nurse and all of that stuff, I am going to just pause for just 1 second. We got a little bit of a technical glitch here. Hold on just a second. Hey, sorry, we're back. Okay, that was a weird glitch, but appreciate your patience. There'll be a brand new website unveiled, which is exciting. It's going to have both a nursing-facing component and a patient-facing component, which is actually going to have the entire, what we're calling web flow, the entire onboarding process for new patients. So that's going to be a very exciting part of the release. We are also going to be starting a new marketing campaign. It's tricky with marketing because of the timing. You can't really start marketing before you have the ecosystem in place. And so the ecosystem, which is made up of you all, the first wave in particular of nurses, and our onboarding web flow for actually taking a patient, bringing them in, getting them signed up, and then matched to a shadow nurse. I'm going to pause for 1 second for a comment from Olivia.
No, all good. Keep going.
Okay, sorry about that. So that is the soft launch. Olivia, did you want to remind me of the date? Is it the 22nd or the 23rd?
It's the 22nd.
Okay.
About 1 week away. We'll both be launching.
I'm trying to buy more. I'm trying to buy more time. Awesome. Okay, so please, folks who are just joining, you can put comments in the chat if you're familiar with that, and hopefully we'll get those as well if you have any thoughts or questions as they come up. So that is, in a nutshell, the soft launch, the 22nd, brand new website, brand new onboarding flow for patients, a section for nurses on the website, and a new marketing campaign. And marketing, I think what we'll just say for now is there's a handful of ways we're going to be approaching that. Number one is social media. There are some things we've become aware of that are very advantageous in terms of social media for reaching groups of people that we think have a high likelihood of needing shadow nursing. And so we're going to leverage that. You'll see that marketing come up. I'm just going to not mention exactly what it is right now. But we will have a whole campaign ready to launch on the 22nd. And then the other thing is word of mouth. And so we do really rely on patients spreading the word to other patients, and there will be a whole referral program available to patients who've signed up and are getting the service and want to recommend that to their friends and family and other loved ones. And then another thing is just your contributions in terms of spreading the word as well. So we will have a mechanism in place for if you recommend a patient to join, that they could become your patient. So if it's a patient that you want to shadow nurse for and you bring them into the system, then that would be your patient. Patients who just come in to the system on their own or through marketing will get assigned to a shadow nurse based on a number of other different criteria. Things like language spoken, region of the country, conditions that they are most interested in addressing, cultural preferences, age, things like that. There'll be a whole system of attribute matching that happens when somebody onboards as a patient. And so that's where highlighting your attributes, things like, all those questions that we ask are really for a very important reason, because we want to know if somebody, we had somebody mention that they spoke Swahili, so we want to make sure that we have a nurse that can meet them where they are with language requirements in the situations they're in. Or if we're thinking about launching in a particular location, Miami, for example, there's going to be a heavy need for additional language spoken based on that location. So you can see how the attributes and things that, how many years of nursing you have in oncology, how many years of nursing you have in pediatrics, how many years of nursing you have in any variety of specialties, how much experience you have with your local and regional healthcare system in the area that you are. Are you rural? Do you understand rural health? Is that a thing that you thrive in? Do you understand urban health? Do you understand Medicare? You don't need to know. You don't need to have all these things. Part of the what we're looking at for the different waves, as I mentioned at the beginning, is you might just have one of those, but that's something we really need for launching in a particular area. So all those attributes will come into play. So keep us up to date on those kinds of things. It's very important. With that, unless Olivia wants to chime in at this point on anything, we will then move on to the potential partnership announcement. We're good. Okay. So this is the moment that some of us have been waiting for. I think it's kind of exciting. I'll just say we did put out a survey. We got a number of answers, really, really cool answers from folks about who they thought the potential partner could be. But I am maybe happy to say, I'm not happy to say nobody got it, because that kind of keeps the anticipation rolling a little bit further and kind of fun. But we had a lot of really good guesses. The top guess by most people was CMS. So that's a great guess. That'd be fantastic. I could see that at some point, honestly. In fact, the number one collective answer was payers. So whether it was United, Optum, Blue Cross, Blue Shield, Aetna, I think every single one of United Healthcare, I think I already mentioned that. Those were all mentioned. And quite honestly, I think we all can see and appreciate a world where payers do pay for this for their constituents, for their members, because it benefits everybody, right? The patient will obviously benefit from having that really high touch patient healthcare navigation. And I'm just gonna, I think I might have unmuted something. And the payers will benefit because they're gonna have a much healthier group of constituents and members, because we have the ultimate opportunity to be preventive in what we do, because we're going to be assisting people in their lives at home, pre-hospital, pre-exacerbation of an illness. And there's so much value in that to the payers. And so it made a lot of sense why that came up as a very prominent guest. It's not a payer. And I know there's a lot of sort of like, mixed feelings when we talk about payers. And so that'll be kind of fun to unpack when we actually start having conversations with them. But for now, we're not looking at a payer. There was another really fantastic guest. There were a lot of guesses around pharmacy, outlet, retail pharmacy. So CVS came up a bunch. Or some other big ones. There was one that I was really excited to see was Red Cross. And the reason I was excited to see Red Cross is that's something that we are actually talking about. It came to light with the recent hurricanes that were hitting the eastern seaboard and the devastation that they leave in their wake. And ShadowNurse, when we're ready, and we have a handful of waves of nurses on board, so that means several hundred nurses, I'd imagine. We want to make ourselves available to those locations to help in the aftermath. And the aftermath isn't just a week. I mean, the aftermath is months and months. And there's really lifelong changes that people suffer through as a result of losing loved ones or losing property or losing income sources that really completely puts them in a different category when it comes to their health and maintaining their health. And ShadowNurse has a really wonderful opportunity to help manage people through that. So Red Cross is a beautiful suggestion. But I think we can go ahead and unveil it. The answer is Ronald McDonald House Charities. And so RMHC, there's nothing signed yet. And the thing that makes it a little bit challenging is that there is a global headquarters and a global outfit for RMHC, but actually RMHC is made up of a number of distinct individual houses or centers or chapters, if you will, which makes it both really exciting on the one hand from thinking about it from a partnership perspective, and it also makes it challenging. The challenging parts are that you can't just go to one place and say, hey, we'd like to strike up a partnership and have one set of conversations and move forward from there. Because they are a national and actually international in a pretty big way entity, but all of them are individually run. It means you kind of have to show up to each place and knock on each person's door and say, hey, how do you feel about us working with you? In Kansas City or in Dallas, Texas. But as challenging as that might be, we are having great success in having conversations with them. We have had several meetings with key people from some of the biggest RMHC houses in the country, and have gotten nothing but overwhelmingly positive cheers and support for what we're doing and about to do. And so we are very confident that we will have one, I would almost guarantee we'll have at least one house to partner with in the new year, if not dozens. And each one of these houses brings upwards of 100 families per house in some of these bigger locations. Some of the smaller locations might be more on the order of a dozen or a couple dozen. But the thing that makes this and one of the reasons maybe that it wasn't guessed as a potential partnership for us is that RMHC is really in the business of helping families with young people who are ill and going through a diagnostic or treatment odyssey. And so it's not seniors and sort of what we originally were thinking as our core demographic, seniors who need a lot of help and are alone and struggling with a lot of multiple chronic conditions. But what makes RMHC incredibly exciting is that while there is the child and the parents or loved ones who are managing that child's journey, who are staying or taking advantage of the services that RMHC offers, the families themselves are actually also really strong candidates for being ShadowNurse clients. And so it's really, it's a whole family or unit kind of approach to shadow nursing that we think is incredible and exciting and could be very explosive for us. the reason that the parents and the loved ones who are managing the children are also targets for shadow nursing is that they are going through a massive life disruption. Just like we were talking about with the post sort of traumatic scenarios with natural disasters, these families are completely uprooted from their homes, sometimes for upwards of a year or more. Many of them are international, and language is a barrier. They are not accessing their typical routines when it comes to healthcare. Oftentimes they can't get their medications delivered to them at this new location. They don't even maybe know how to get medications delivered in the first place. They're not seeing their physicians and practitioners at the cadence that they normally do. They're missing appointments. They're getting sicker, and they just don't have time to manage their own health because they're 100% locked in on trying to keep their jobs and things like that while maintaining some kind of normal life for their family and the child that's in the hospital or being undergoing treatment. So what we've learned through these conversations, and we have dozens of conversations on the books with Ronald McDonald House Charity in certain locations, and there's a very consistent message that these families need an incredible amount of help. And so we are thrilled that we are being considered to be a part of what Ronald McDonald House Charities in certain locations might put in their welcome packets for new families coming on board. And so this is exciting news. It's a great channel for us in terms of getting the word out about the fabulous people who you are and who ShadowNurse is as an entity and a service that can help folks. And so the challenge with like, why can't this happen today, is that this is an incredibly busy time. With the holidays coming up, Ronald McDonald House Charities in all their individual locations go through a massive effort to put on additional services for the families during these holiday times. So they're most interested in seeing how we can launch in the beginning of 2025. So I would imagine that we're looking at something that might take place in January or February of 2025, and complement our marketing strategy that we were talking about previously, which is through our traditional marketing strategy, which would be through social media and things like that, to also have this partnership. We could literally, in a way, if things work successfully with a handful of these houses, it could really catch on like wildfire. We could be looking at the potential of having tens of thousands of families joining ShadowNurse in a matter of weeks or months once we get things going. So it's a really tremendous opportunity. And as we were talking about with hiring and onboarding of shadow nurses in waves, we might very quickly come to a point where we're like, okay, we need the tidal wave. Like we've done wave 1, we've done wave 2, we've done wave 3, and now we're 3 months in, and we're looking at February 15th launching with a number of different RMHC chapters, and we need 500 nurses. So it's going to be exciting to see how this plays out. Nothing's guaranteed. We can't take anything to the bank, but we're very excited that the conversations have been going as well as they have. I wish I'd recorded some because the comments we're hearing back, without even having done a thing yet, are just they're really singing our collective praise. And when I say our praise, I really am including everything that you all have done as premium members and supporting us this whole way. So you are definitely included and deserving of that praise as well. And we will do something either with RMHC, most likely, or if not, something with another organization in a similar fashion. And all your ideas were fantastic, and we'd love to follow up on some of those as well. So I'm going to pause there. Olivia, if there's any additional thoughts on your side, or you'll give me the thumbs up. Thumbs up. Okay. So last but not least, we did want to talk about our support of the Remote Nursing Conference 2025. This we see as a really great opportunity for a variety of different things. One of them is just an opportunity to learn about strategies for being a remote worker in nursing, or really these are things that you'll learn that would be applicable to more than just remote nursing, although that's really the sweet spot for all of us. But these are strategies that will not, beyond even remote work, they're things that will help you become a tech savvy person in this world, and use it in your daily life in addition to any work opportunities you have. It's one of those things where I guarantee, looking at the topics that will be covered, I guarantee that we're all going to learn something that we didn't know. That'll be more than worth the price of admission or the time it takes to attend. In addition to all the technical learnings and opportunities there, including this workshop, which is really going to kind of go over advanced topics in technology, there are going to be things like networking opportunities, keynote speaker events, panels of who will have on those panels representatives from some of the top organizations around the country that really focus on remote working, particularly in the healthcare setting. So as a little teaser, we're working on getting one of the past medical directors of Doctor on Demand, who was there for almost a decade, who really specialized in growing telehealth as a thing in the United States. It's legal and actually possible. When this gentleman who we're in conversations with started at Doctor on Demand, you couldn't do telehealth legally in many places in the country. And so learning how to build remote teams successfully, this is just one example of the kind of expert that we are hoping will be showcased at this event. And there's also going to be networking involved, some fun stuff too. We couldn't be more excited than to be a part of putting this on and sponsoring it in this way, and hope that everybody, certainly everybody here on this call and everybody who's watching this would consider attending. And if it's successful, we hope to look at other ways to sponsor events similar to this. And I said this at the outset of the call. This is not a ShadowNurse hype meeting. It's really going to be unbiased in terms of learning how you learning what jobs are out there in the remote stratosphere. And so we really want to promote. We're going to make sure, at least from our perspective, that there is the opportunity for folks to learn about career opportunities that are not ShadowNurse related, but just other opportunities that might be available to you for remote work. Olivia, any thought about that? I'm going to mute myself for just a second.
Yeah, thank you. Yeah, I was having some technical difficulty on my side with talking, but you're saying what I was going to say over and over, so it's good. Remote nursing conference, though, I definitely want to take a minute. I am super passionate about this, as you guys know, and I saw it as a great opportunity for ShadowNurse to sponsor because of really getting down to it, the skills that you guys are going to need to work as shadow nurses. And this is becoming more and more apparent to me. Having worked in tech for 10 years plus, I am fortunate enough to have had a great deal of remote work experience in various settings, especially tech focused. And that's a subset of remote skills, right? Working at a tech company like ours requires additional skills beyond working for, say, a telemedicine company that, your primary job is to, provide direct patient care. We are building tech. We're engineering, right? So the skills that are going to be highlighted in this conference and what I really pushed for in this conference are unique in a way to tech and AI and what I see as the future, the real future of remote nursing. Of course, there's a boom. We all want remote jobs, of course, right? And I am extremely passionate about getting that to as many nurses as possible. The friction that I'm experiencing in full transparency is and I'm fortunate, I'm grateful that I've gotten to review thousands of nurse resumes looking for remote work, thousands. So I am hopeful that this conference is it's a burst. It's a 2-day opportunity to get you guys the skills that you need to get a job, to perform and go above and beyond and really excel at ShadowNurse, but really any tech company out there that you apply to and make you stand out. I'm seeing gaps in tech skills, which makes sense. It's nobody's fault, right? We're all coming from bedside trying to get remote jobs. But the competition is fierce, as you can tell. And on our end, we're working as hard as we can to build a company that can give as many jobs as possible. But I am sensitive to the fact that we all want remote jobs now, right? So what I'm excited for here is this almost like deep dive 2-day conference that's going to get you exposure to what you need to learn to stand out and how to structure your resume and how to use different tools that are just commonplace everyday speak in tech companies that we just wouldn't have exposure to. But it's a gap. It's a definite gap on the resume. And when I'm looking at resumes, there has to be some filter. There has to be some way to narrow it down. And I'm really honing in on the tech skills section, the computer skills section of your resume. And does it say certain tools? One tool, obviously, that I talk about a lot is Slack. Slack has to be something that you know of and have probably downloaded and played around with and can say that you've taken some steps to familiarize yourself with. Zoom, obviously, as well, Google Meet, Google Suite. Like, do you know what Google Suite is? These are all things that I can tell you any tech company is going to be looking at right off the bat. But the good news is for you guys, right, is that you're ahead of the curve. You are premium members, you're learning, you're aware that tech is a boom and that you need to learn about it. And there's, maybe less than 1% of resumes that I've reviewed have these skills on it. So I wanted to make that public service announcement, if you will, give you a little bit of insight into how my brain is filtering these things and working through these things, because it's a tremendous opportunity. And the nursing profession, there's going to be a wave. There's going to be an initial subset of nurses that are, the early adopters, right? You guys have heard all these things. There's early adopters, people that are willing to jump on board and follow new trends without enough, like very much proof, right? And I love those people. So thank you for being those people. And then there are the people that wait a little bit and see how things are going to unfold before they trust and, jump on board. That'll be the next wave, right? So I think the 2025 is that year for nurses, the nursing profession. We're going to have a bigger wave of people that are getting the skills to do these things. And then they're called the laggers. I don't like that. It's kind of negative. But the people that, wait a little bit longer, and then they'll kind of jump on board too. But this is going to rise the whole ship, right? The whole nursing profession into what I think is a modern, 2025 tech heavy future that's coming. So that in a nutshell is why I'm super excited about this conference, why we're sponsoring it, why we're involved, because I know that, the people that are going to be shadow nurses are going to need these skills. And like Jeff said, teed it up beautifully, these waves of hiring, being part of the next wave. If you already have these skills, you're in and you're going to get patients and you're going to, make money from home. So that's what I've been really focused on here. Putting on a conference is a big lift, but I know that it's going to pay off, and I couldn't be more excited about it. And then I just had a couple comments from, as I was having those technical difficulties. Ronald McDonald House, so excited about that. The family, getting inside the family is where you take hold, right? If we can get a shadow nurse into every family and every home, then it's not just the grandparents, right? It's not just the parents, it's the kids. And then we are enabling and supporting the future generations so that a shadow nurse becomes commonplace, right? It becomes like, who's your shadow nurse? Call your shadow nurse, text your shadow nurse. Like that's the question for your shadow nurse. And the whole family has a point person, or at least a method, right? Somebody in their home to prevent issues. And you guys know the spiel from there. So RMHC is a blessing that, we kind of just went with, and it really feels like it's going to pan out. And Jeff is leading that effort. So great job, Jeff, and the team that's doing that. Payers, I just want to call out 100% payers. You guys know that we spent a big chunk of time last year working on CMS and trying to understand the reimbursement models and how that'll work. And it came down to just, it's so early, and there's so much legal and regulatory requirements that go into that, which is on the order of, $100,000 plus to pay for lawyers to figure that out so that we don't get into legal issues with billing CMS, right? But the model, right? The model that we're working with is a freemium model. So patients come on, our MHC, for example, come on board for free, and they get a subset of services for free in the beginning. And then there are, ways to make money here and there for different services based on their needs, right? It's a very common model now. Once we establish what we do in the services and we have documentation to provide to payers and show that we are improving lives and preventing hospitalizations and saving the health system money and saving insurance companies money, then that's where, the timing and the intersection of that plus our services will align. So payers 100% are in our future. So great job with those guesses. And I think that those are all of my notes. But I think like I said, we're at an inflection. We're at a cross section right now. We got the nurses. You guys are incredible. You're here, you're with us. We have the nursing power, the tech skills, that's coming right now too. So we're getting you guys the tech skills that you need to do this thing. We have the web flow coming. We have an easy system to get patients and nurses connected that we're going to launch in a week. Jeff mentioned a few social media marketing tools that we're going to launch as well in a week to get more patients on outside of RMHC. Brand new website. So what do we look like? What is our brand? It's still a baby brand. You know, the branding like Facebook and Google and telemedicine companies and all that is, you know, multi-millions of dollars, right? So I'm really proud of the work that the team is putting in to do what we can with what we have. I think it's brilliant and is going to be amazing. And then funding, right? So that's just how businesses and startups eventually grow. So of course, I'm focused on that, hyper-focused on that. You guys might have seen my post on LinkedIn that we submitted for a grant application. That took a year. It was a big lift. So good job to the team there too. But I am very proud of this application. So I have no doubt that it won't come through in a couple months. So 2025 is the year. 2025, we're here. It's all come together. So yeah. Jeff, back to you.
Awesome. Thanks, Olivia. I think that just about caps it, honestly. I don't see, I might could be missing it. As much as we swim in the deep ends of technology, sometimes we are grabbed by the ankles and pulled down a little bit as well. So I don't see any questions that have come in so far. I did just want to highlight that we will be posting this for all to review or to see if you weren't able to attend the full meeting or weren't here in the first place. It'll be posted in the normal channel, so you'll see all of that. We can't thank you enough. Honestly, as Olivia was saying, the fundraising and such, you know, we've been self-funding this effort, and it's really not possible to do what we're doing right now without your support. And so thank you. I just really, honestly, every day we're so grateful to you that we can eventually do this so that we can all benefit and thrive in many ways and help people and completely change what healthcare looks like in America. And worldwide. So we're close. We're super close. So that's why we're really excited about these launches coming up. And stay tuned for more messaging. And there will be a wave that I'm sure you're all going to be in. And we can't wait for that moment too. Thank you very much. I think with that, we'll wrap it up and save the video for posting later. Thank you so much.